Some people say Washington hospitals need to invest in Northwest nurses. Others say hospitals have no choice but to look beyond this country for help.
If you drive by Children's Hospital in Seattle, you probably won't see nurses on the march anymore. Today, the Washington Nurses Association reported that a tentative contract agreement has been reached.
The smallpox vaccine can save lives, but it's still a very risky shot. Now, some in Washington's medical community are asking whether it's a worthwhile risk.
Sacred Heart Medical Center and its nurses are fighting over a hot-button issue tonight.
It's a collective bargaining right to be able to wear buttons that represent the focus of our union.
It includes provisions to limit mandatory overtime and gives nurses more of a say in patient care.
Many nurses tell us it's not only a win for them, but a win for you.
WSNA represents more than 13,000 registered nurses in the state in more than 50 local bargaining units, including hospitals, public health districts, veterans' homes, visiting nurse services, and jails.
I see WSNA as the leader in protecting my rights as a nurse.
We're the largest union of registered nurses in the state. We're the only union that represents only registered nurses. Everybody else represents others.
By joining WSNA, you also become part of 3 powerful national organizations working together for nurses in the United States: the American Nurses Association, the United American Nurses, and the AFL-CIO.
One of the ways that WSNA has helped to make life better for nurses is to look at things like job satisfaction, job pay, days off, flexible work schedules, making sure that people get their breaks. And many times we have to do that through an arbitration process.
WSNA is different from other organizations. It encompasses nursing practice, education, legislation, collective bargaining.
I see WSNA as the only organization that attends the Board of Nursing Commission meetings and really defends my rights to practice nursing in this state.
Because we're the only union where every decision is made by a nurse.
As the largest and oldest union for registered nurses in Washington state, WSNA has the experience, resources, knowledge, power, and authority to make a real and lasting difference in the workplace.
The primary difference is that it's a multi-purpose organization. It's run by nurses for the benefit of nurses. It does have a practice department. We are the voice at the table in the legislature and in the policy-making areas on issues that affect patient care and nursing practice.
There's always nursing presence in those venues where nursing's voice must be heard, and we are the ones who do that.
WSNA is considered an expert across the state for any issue that involves nurses.
It gives us our voice. It gives an individual a voice. That means that I have a right to speak out and say, this is my belief, this is what I need. But it also gives a voice as a group. That way we know the issues right from the bedside all the way up through all the different levels. We know what we need to better take care of our patients and better take care of ourselves.
You know, WSNA truly captures the whole picture of what an organization should do for nursing. Initiating legislation to help improve practice and improve patient care in Washington state. The other unions and frequently the other associations will jump on the bandwagon once we've got the groundwork done.
Going to Olympia and really speaking together on issues that affect so many of our communities, and in a voice with so many of the nurses who have a diverse view on things was really awesome for me.
A few years ago, WSNA was key in passing legislation to protect nurses in some settings in Washington from mandatory overtime. And that impacted me. And I wasn't safe when I had to work overtime. That was key for providing safe care to patients.
WSNA does so much for me that I benefit every single day. Being a member of WSNA, I benefit by having a board of directors who are nurses, who are elected by the nurses in Washington state. I have a practice counsel who works on position papers. Those are published, for which I can utilize when it comes to talking with management at the hospital for standard of care.
With the contract, it shapes our work environment, it supports our nurses, it allows us to have a grievance procedure should that be necessary.
With our contract, nurses are negotiating for nurses, and I think that's a unique thing, and I think it's a very powerful thing.
It also helps us to take better care of our patients because we're taken better care of.
After becoming involved with contract negotiations, I decided I wanted to do more because I could see the positive changes taking place in the hospital. I can see the positive changes taking place with the nurses and what I was able to do. So I became their grievance officer. I think it's important to belong to WSNA because WSNA represents nurses in every sense of the word.
I really feel that we have such an ability, if we collect and group together, that we can really create an area and an environment that's more nurse friendly, and I think that we can do more when we organize and we work together, more for our patients.
I know that hours, wages, and working conditions directly affect the care we give.
I've always thought that if you do what is right for nurses, you'll do what's right for patients.
I think it's not only important for nurses to belong to WSNA, I think it's critical. Because if we don't, other people are going to make the decisions for us. Either we're the ones in the driver's seat, at the legislature, at the negotiation table, wherever it is, either we're going to be making the decisions or somebody's going to do it for us.
You can make a difference.
Membership is the key to success.
It is my union, and in order for my union to work for me, I need to work for it.
And the more members we have, the stronger we are.
Nurses are speaking for nurses in WSNA, and because we speak for nurses, we speak for the patients.
If nurses come together as one voice, we could truly drive what healthcare does in this country.
One voice can't do it. 5 voices can't do it. But 5,000 voices can do it. Or 10,000 voices make a much louder sound. So the strength is in numbers.
Join WSNA now. Working together, we're your union and a whole lot more.